First question, test for flavanoids. Options are Lieberman-Bucha test, Morley's test, Rothera's test, Shinoda test. Test for flavonoids. Okay, and the answer is Shinoda test. Test for flavonoids is Shinoda test. Next question is tablet exerting local effect in throat. The options are elixir, lozenges, pain, colloidal. The answer is lozenges. Tablet exerting local effect in throat is lozenges. Next question. Minimum area to start retail drug store. The options are 15 square meter, 12 square meter, 10 square meter, none of the above. And the answer is 10 square meter. Minimum area to start retail drug store is 10 square meter. Next question. According to Drug and Cosmetic Act and Rule, phenobarbital is a Schedule X drug, Schedule G drug, Schedule H drug, Schedule C drug. The answer is Schedule X drug. According to Drug and Cosmetic Act and Rules, phenobarbital is a Schedule X drug. Next question. Crystalluria is the side effect associated with. The options are quinolones, azoles, sulfonamides, taxol. And the answer is sulfonamides. Crystalluria is the side effect associated with sulfonamides. The sixth question is the Drug and Cosmetic Act was passed in. The options are 1940, 1945, 1947, 1946. And the answer is 1914. The Drug and Cosmetic Act was passed in 1940. Next question is tropane alkaloids can be identified by. The options are Thalequin test, Vitaly-Morin test, Biuret test, Millen's test. And the answer is Vitaly-Morin test. Tropane alkaloids can be identified by Vitaly-Morin test. And the eighth question is 1 fluid ounce is 60 ml, 15 ml, 30 ml, 10 ml. These are the options 60 ml, 15 ml, 30 ml, 10 ml. And the answer is 30 ml. 1 fluid ounce is 30 ml. Next question is, hospital acquired infections are called. The options are primary infection, secondary infection, nosocomial infection, latent infection. Hospital acquired infections are called. The answer is nosocomial infection. Hospital acquired infections are called nosocomial infection. The next question is, second edition of IP. The options are 1955, 1947, 1985, 1966. Answer is 1966. The second edition of IP is published in 1966. Eleventh question is, drug of choice for atropine poisoning. The options are neostigmine, pralidoxime, physostigmine, and acetylcholine. The answer is physostigmine. Drug of choice for atropine poisoning is physostigmine. Next question. Cold cream is an example of dash of emulsion. The options are oil in water, water in oil, neutral, none of the above. And the answer is water in oil. Cold cream is an example of water in oil emulsion. Next question. Morphine is isolated by. Options are Darosen, Serturner, Pellator, Calverton. The answer is Serturner. Morphine is isolated by Serturner. Next question. Which of the following first line TB drug is not bactericidal? The options are ethambutol, rifampicin, streptomycin, isoniazid. And the answer is ethambutol. Which of the following first line TB drug is not bactericidal? That is ethambutol. Next question. Tetracycline is obtained from. The options are bacteria, fungi, soil actinomycetes, protozoa. The answer is soil actinomycetes. Tetracycline is obtained from soil actinomycetes. 16th question is, father of Indian pharmacy. Options are ml Scroff, Galen, Hippocrates, Aristotle. And the answer is ml Scroff. Father of Indian pharmacy is ml Scroff. Next question is chemical used as haemostatic is. Options are ferrous sulfate, ferrous fumarate, alum, copper sulfate. And the answer is alum. Chemical used as haemostatic is alum. 18th question is boric acid is freely soluble in. The options are water, alcohol, glycerin, all of the above. And the answer is glycerin. Boric acid is freely soluble in glycerin. Next question. Dose of a drug available to patient is called. Options are bioavailable dose, bioequivalence, physiological availability, bioavailability. And the answer is bioavailable dose. Dose of a drug available to patient is called bioavailable dose. Next question. Gregorys powder is. Options are cathartic, coloring agent, astringent, hematinic. And the answer is cathartic. Gregorys powder is cathartic. Next question is Hagers reagent is picolinate acid, picric acid, racemic acid, picrinic acid. These are the options. And the answer is picric acid. Hagers reagent is picric acid. Next question. Rannuaculaceous stomata is also called as. Options are anamocytic, anisocytic, diacetic, parasitic. Answer is anamocytic. Rannuaculaceous stomata is also called as anamocytic. Next question is drugs inspector is appointed as per the provisions of. Options are Pharmacy Act 1948, Drugs and Cosmetics Act 1945, Drugs Inspector Act 1940, Narcotic and Psychotropic Substances Act 1985. The answer is Drugs and Cosmetics Act 1945. Drugs Inspector is appointed as per the provisions of Drugs and Cosmetics Act 1945. Next question is, organophosphorus poisoning is treated with. Options are acetylcholine, atropine, pentazocine, methacholine. Answer is atropine. Organophosphorus poisoning is treated with atropine. Next question is, Epsom salt is. Options are copper sulfate, ferrous sulfate, calcium sulfate, magnesium sulfate. Answer is magnesium sulfate. Epsom salt is magnesium sulfate. Next question is, Antixerophthalmic vitamin is vitamin E, vitamin D, vitamin B, vitamin A. These are the options. And the answer is vitamin A. Antixerophthalmic vitamin is vitamin A. Next question. Drug of choice for arsenic poisoning. Options are penicillamine, dimercaprol, EDTA, K-menopur. Answer is dimercaprol. Drug of choice for arsenic poisoning is dimercaprol. Next question is, anti-retroviral agent is oseltamivir, didanosine, acyclovir, edoxuridine. Answer is didanosine. Anti-retroviral agent is didanosine. Next one is, schedule dealing with clinical trial is. Options are Schedule V, Schedule W, Schedule Y, Schedule T. And the answer is Schedule Y. Schedule dealing with clinical trial is Schedule Y. Next question. Absence of menstruation is. Options are amenorrhea, dysmenorrhea, menarche, menopause. Answer is amenorrhea. Absence of menstruation is amenorrhea.